Hey, this is Dr. Rob, and I welcome you to another one of my whiteboard sessions. And today we're going to discuss, is the downward magnesium spiral connected to your adrenal fatigue, insomnia, anxiety, weight gain, and just feeling like yuck? Before we do that, please take a second, hit the subscribe button, hit the notifications button so you can hang out with me and we can hang out with each other. All right, so what's the low magnesium spiral? What's the correct type of magnesium to take for you? And how do we get to root cause? So these are important questions to ask and answer. So first off, the low magnesium spiral is this. You have depleted magnesium. There's not enough magnesium in your body for one of many reasons, which we'll cover in a second. But what occurs is when there's not enough magnesium in the body, that increases the inflammation in the body. So low magnesium, high inflammation. When there's too much inflammation in the body, the adrenal glands are now forced to overproduce cortisol. Cortisol is your most powerful anti-inflammatory hormone, so that's why the adrenal glands raise it. The issue is if cortisol goes up, well, that's increasing the amount of adrenal stress. And when the adrenals are more stressed and there's more cortisol, we're now depleting magnesium. So magnesium gets lower. We have more inflammation in the body. More inflammation in the body means greater adrenal stress because the adrenals have to knock out the inflammation with excess cortisol, which equals depleted magnesium. And we get into this downward spiral, which really ends up with a person having insomnia, anxiety, inward or internal trembles, muscle cramps, aches, pains, inflammation, cravings for salty as well as sugary food, gastrointestinal disturbances, and just an overall malaise. How do we address this? How do we remedy this? Well, first let's talk about the types of magnesium. So if you feel like you're fitting into this category of this downward magnesium spiral, we want to talk about magnesium. If you notice you have more pain and inflammation, if that's your primary symptom, you're going to want to supplement with magnesium malate. Magnesium malate is essentially a magnesium molecule bound to a malic acid molecule, which is really good as far as reducing inflammation in the body. It's great for the mitochondria. Malic acid is good for the mitochondria. So this is good for people with fibromyalgia that have connected or associated adrenal fatigue. So the next one is magnesium glycinate. If your primary symptoms are anxiety, insomnia, mind is racing, this is the time we want to use magnesium glycinate. High levels of stress as well. We want to use magnesium glycinate, which is a magnesium molecule bound to a glycine molecule. Glycine can be an inhibitory neurotransmitter in the body. It means it's very relaxing to the body. So it's good to calm the body. It improves sleep. It reduces anxiety. It reduces stress. The next one is magnesium threonate. If you feel like your brain is dead, right? If that's your primary symptom, where your brain is just dead, you can't focus, you can't concentrate, you don't know like what's going on, you keep forgetting things, you walk into a room, you're like, I came in here with a purpose, I have no idea what it is. If that sounds like you want magnesium threonate. Threonate can also be good for anxiety and depression as well. And the last one is magnesium taurate. If you just have everything, like all the symptoms, and there's no real primary one, magnesium taurate is a magnesium bound to a taurine molecule. The reason why that's amazing is taurine is an amino acid that literally takes the magnesium, grabs it, and drags it into your cell. So magnesium taurate is a super bioavailable form of magnesium that really pulls magnesium into the cells, which is where we need it. Now, the most important thing is sometimes we're in this downward magnesium spiral because of increased adrenal stress. So sometimes it starts here. There's increased adrenal stress, increased cortisol, adrenal fatigue, which depletes magnesium, which increases inflammation, which creates more adrenal stress, like we've already talked. So how do we handle this? Well, for that, right here, guys, we got to identify root cause. In that case, there's almost always something stressing the adrenals. Remember, they are the stress glands and anti-inflammatory glands of the body. So we have to look, is there something in the body producing inflammation? Parasite, yeast, bacteria, fungi, mold, heavy metal, food sensitivity, environmental toxicity, virus. What's there? There's almost something there that's increasing the inflammation. Is it from an outside stress source? Is it a mother-in-law? Just kidding. I actually love my mother-in-law. But is it a family member? Is it a friend, quote unquote? Is it a work colleague? Is it someone at church? Is there a person? It's almost always often a person that's adding to the stress in your life, right? So we want to go ahead and follow those adrenal guidelines for making sure we're keeping our boundaries in and all the other things we do. That's the most important thing, is identifying root cause. You want to supplement with the right form of magnesium. If the symptoms are better but still there, then no, there's a cause. So you got to get to the root cause. What's the cause? It's something. You just got to go find it and dig it up. Okay, if you need some help, you could always reach out to us. We're here. If you're on my website, there's a link somewhere where you could fill out a survey or an evaluation. Feel free to fill that out, and we're happy to give you some help. If not, I'll catch you at the next whiteboard session, and thank you so much for being here today. Bye.